Hello and welcome to the Business of Story. I'm Park Howell, your host, and apparently running partner for many of you, so I've recently learned. And I'm so happy you're here making this one of the world's most downloaded shows on how to use brand storytelling in your business. Today we have two amazing frontline communicators from Banner Health who will show you how they've been combating misinformation and COVID while rallying their troops using storytelling. But first, today's story marketing moment. If you want to identify the stories at the heart and soul of your brand, which I hope you do because this is where the real gold to storytelling is, then I want you to try my OO exercise. That's 3 O's, O-O-O, and they stand for organization, offering, and outcome. You'll want to find 3 stories in each of these categories: organization, offering, and outcome. And here's how you do it. Start by creating 3 columns. Column number 1 for organization, column number 2 for offering, and you guessed it, column number 3 for outcome. Now, write down 3 one-word descriptors for each category. These will become your themes for your stories. Write 3 words that describe your organization, 3 words that describe your offering, being your product or service, and 3 words that describe the outcomes you create for your customers. You'll end up with, that's right, 9 one-word descriptors. For instance, my descriptors for the organization of the Business of Story are mage, industrious, and optimistic. These 3 words really define what my organization is all about. For my business storytelling offering, they are primal, dynamic, and truth. And for outcomes, my 3 one-word descriptors are clarity, connection, and trust. Now that I have these 9 words, I go and I find all kinds of stories using each one of these words as a theme for that story to demonstrate the real-world impact I make on the people who I serve. I have learned that stories convey the truth that creates the trust. 2 words, by the way, as you probably noted, that are in my 9 one-word descriptors for the Business of Story. Trust in particular, although it seems in short supply these days, is the currency that all brands use to survive, thrive, or when untruthful, die. If you'd like to dive deeper into the OO exercise for your brand with lots of different examples of how to do it, then grab a copy of my new book, Brand Bewitchery, now available on Amazon and Apple Books. And to prove my premise, you'll hear about the importance of authentic and truthful storytelling in today's episode, especially when combating a pandemic.
For me, if I'm telling the story of a man in his 40s who got COVID with no pre-existing conditions, who was hospitalized on a ventilator for 3 weeks, he's recovered and now sharing that story with others. What I want to get out of that is those, 20, 30 somethings that are going out to bars, partying, not wearing masks, congregating because they think that the virus can't get them. I want to show them that it doesn't discriminate and that there are people out there who, for one reason or another, we still are learning about this virus. We don't know everything about it. And clearly he was a healthy man in his 40s that got that virus and it almost took his life.
That was Rebecca Armendariz, Senior Director of Marketing and Public Relations at Banner Health. Joining Becky on today's show is Jennifer Russo, Senior Director of Corporate Communications and HR Strategy for Banner, which is one of the largest nonprofit health systems in the United States. Banner is based right here in Phoenix, Arizona, and operates 28 hospitals and several specialized facilities across 6 western states. Today, you will hear from these 2 highly experienced COVID frontline communicators who share what they went through and learned from the first wave of the coronavirus and how they are preparing to battle misinformation, communicate truth to the public, and rally their troops as America moves into a second surge of this scourge. At the heart of their story is a powerful brand narrative for Banner Health that is the foundation for all of their communications. So please welcome to today's Business of Story episode, Jennifer Russo and Becky Armendariz. Jennifer, Becky, welcome to the show.
Thanks for having us.
Thank you.
This is really the first episode we've done where we've got frontline workers in the form of communication experts on the show that have been through the thick and thin. Well, it's pretty much all been thick, hasn't it, of COVID, through that first surge. So we are recording this episode on October 16th. And I think we are all preparing for a second surge and starting to see that happen in a lot of different states around the country. Arizona's been doing a really nice job over the last couple months, but we're starting to feel it hit here again. So on today's show, what I would love to cover with the both of you is, what did you learn through that first surge in communications, in crisis communications, and what are you doing to prepare for round 2 of COVID coming in and hitting us this fall? And what can our listeners take away from some of the things that worked for you and didn't work for you? So if they're working on their own crisis communications or just trying to keep their own people safe and calm and optimistic through COVID, not only now, but what is intended for us, in the next 6 months to a year. Not a big task today, right? Jennifer, let's start with you. Sure. Director of Corporate Communications at Banner Health. You have had a career of working internationally in all kinds of environments of communications. How has your past helped inform what you are doing today at Banner Health and helping to kind of corral communications and showing an optimism in it and being, truthful and showing people the way forward?
Yeah, Park, I'll tell you, I think that I have certainly worked in crisis across the many decades of my career, but never anything as sustained in duration as this, and nothing where the recovery really isn't unknown when that's going to come about. So I think I was able to pull on that experience, but this has absolutely been unique. A couple of things. I think, Park, some of the old adages are true, that people need to know you care about them. You need to be able to share the information in a way that's factual and consistent. And you need to make use of the subject matter experts that you've got within your organization and the tools that you've got at hand. And I can tell you more about that in a bit.
Great. And Becky, you handle marketing, communications, and public relations. So the PR side, I would imagine, has been quite a struggle or a journey, if you will. What are some of the lessons, some of the first things you've learned through Surge 1? What were some of the surprises and how are you preparing for round 2?
Sure. So unlike Jen, I've spent most of my career in the healthcare industry. So I've been with Banner for 12 years in various roles. I think one of the things coming into the first surge, and even in the very early days of the COVID virus being here in Arizona, we stood up our emergency operations center. I think one of the benefits we had in the healthcare industry coming into this pandemic was we already had a plan and a structure in place for how we were going to address the pandemic, how we were going to assign roles, and who was going to be responsible for what. So rather than having to sit around for a couple days and figure all that out, we were immediately able to jump into action. One of the things we realized early on that we did not have in place, which I think is one of our lessons learned from that first surge, is there were certain technologies and functions that we didn't have in our toolbox when COVID hit us that we've been building out over the past few months to deploy externally. Specifically in my area, we're developing a platform for virtual press conferences. We had never done a virtual press conference prior to COVID.
It was always in person.
It was always in person. There hasn't been a great need for it in the past because our focus has been a lot on local media, and local media would come to our press conferences. So when COVID hit and the recommendations from the CDC came out about distancing and not gathering in large groups of, more than 10, we quickly realized we needed to develop that platform. And so it's one thing that we will have in our toolbox for the next surge. And I think the other lesson learned that I have from an external standpoint is just making sure that our communication is that there's a cadence and predictability to it, because people are getting information from so many different places. And if they know when the information is going to be coming from you and they can rely on that, day and time and format of that messaging, I think it will greatly help us in getting that message out there consistently and accurately.
And I would imagine in this time that is so uncertain, nobody knows what the heck's going to happen tomorrow. Having that predictability coming from one of your healthcare leaders is super important, because it's like, all right, we need to be turning to you all so we know we're going to get an update at 10 a.m. tomorrow.
It's so important. And actually, Harris Poll did a survey and came out with 72% of consumers trust healthcare organizations and systems more than they trust the government as it relates to COVID. So,
but shouldn't that be like 100%? I mean, I'm not going to turn to Banner Health for my laws and my social rights. I'm going to turn to healthcare providers to help me know, how do I stay safe through a pandemic? It still blows my mind that that's not even a higher number than 72%.
Yeah, but I think, if you think about it, the CDC is government funded and the oversight is within our own government. And we have governmental leaders who are very vocal about COVID and feel that it's their responsibility to make certain decisions around COVID. And so you do have people putting messages out there about COVID who are not medical experts. And it's just, I think the Harris Poll research just reaffirms for us what we already knew, which is we should be the health experts guiding people through healthcare decisions. But it just reaffirmed the fact that, if we're putting something out consistently, whatever the government is saying, our truth is going to be held at a higher standard.
And my guess is, prior to this, when people heard about the CDC, Center for Disease Control, that they didn't think of it as a government entity. They thought it was healthcare providers and scientists trying to keep us all safe. But the administration has done nobody any favors by degrading and undermining what's coming out of the CDC, and even maybe the CDC not standing up for themselves and the people. But I won't get on that soapbox. Let's come back to Banner. Jennifer, there must have been and since you handle corporate communications and HR work, how did you handle first that internal story when the first surge started coming along? And let me preface that with one other thing, because Becky had mentioned it. I was trying to picture myself a couple months ago, like in your shoes or in a large corporation shoes, and they're going through, all right, we are going to plan for a pandemic. And, they might have been doing this over the years, but probably it gets to the point that planning becomes complacent, because you're like, yeah, that only happens in Hollywood. We're not really ever going to get hit by a pandemic like we have. Well, we did. So the fact that you could spring in action and people are like, oh, good, I'm glad we practiced. It must have still had a huge impact on your internal colleagues about what do they do? How do they stay safe? What is our next step here?
Oh, without question. And like Becky said, and I just want to reinforce that, the EOC at Banner is incredibly well staffed. There are the Emergency Operations Center.
Thank
apologies. I got to throw an acronym in there once in a while. It's incredibly well staffed with subject matter experts. There are desktop exercises. Absolutely, Park. Was there a desktop exercise for a pandemic? That would be we don't have that crystal ball, but I think the general governance and process flow and information sharing and how we meet and the ability to ramp that up instantly was incredibly impressive. I want to put a fine point on something Becky said, which may address your question to some extent. I think that consistency was a lesson learned for us, and it flowed into all of our channels. So initially, there was all of this information, and it was new, and it was often contradictory. And because we care so deeply about the safety of our people, we felt compelled to communicate instantly with them what we heard about masking requirements or eye shields or whatever the PPE of the day was.
Just to be clear, that contradictory information was coming from
apologies,
on high, and it wasn't coming internally.
It was not coming internally. It was what we were all consuming as a public.
Yeah.
And so those guidelines were changing. And so we were communicating almost instantaneously that information. But what that does is there's that unreliability. And so a leader gets an information on Friday, and they've got frontline staff that come in on the weekend, and they're not caught up with their frontline staff. So we moved pretty quickly to a system of providing huddles for the frontline staff and then a weekly leader bundle. And that predictability and reliability of that information has been critical. We also have a long tenured CEO who's been there 20 years. And there's a lot to be said for that, right? And he increased greatly his visibility and started to tell stories, Park, about the people, not just about the personal protective equipment, but the supply chain people who were producing and working 7 days a week around the clock, working through supply chain bottlenecks to get the PPE that those team members needed. Stories of frontline nurses and, just the incredible willingness of people. We had over 3,500 team members redeployed and upskilled so that they could work in different areas of the business. I could go on and on about the human interest stories that we were able to bring to life through this, because ultimately, we are an organization that is about saving patients' lives and providing excellent patient care. And it was infusing that heart into these stories, even in such a really difficult time. So it was the predictability of the mechanisms, and it was making sure we told the why and the how and not just the what when we made decisions.
What was one of the biggest challenges or stories that people were telling themselves internally that you immediately had to overcome with the colleagues at Banner?
Yeah, I think, Park, really speaking super candidly, I think that the PPE was really one in the beginning because the information was changing so rapidly. There was a concern about, are we preserving PPE at the expense of taking care of team members? But of course, that was never what it was about. There were legitimate shortages, and we had to manage for that. And then the changing requirements around masking. Don't wear a mask, do wear a mask. You can wear this mask and not that one. I think that created a great level of uncertainty for people and disruption. And ultimately, we've come to a great place with that. But it was a bumpy road.
Mm-hmm.
I think really what we needed our employees to understand, and why we started infusing more of those heart-forward messages in our communications, is we can't save as many lives if we don't keep our team members safe. And so they're inextricably linked. We can't do one without the other. We need the healthcare workers in our community are our most valuable resource in the COVID pandemic. And we would never do anything to intentionally put them in harm's way or endanger, their safety when it comes to this virus. And so we really had to start communicating that, in everything that we pushed out to them.
Becky, did you ever have the instance where the story got out ahead of you and it was an inaccurate story and you had to come back and fix that? And what did you learn from that?
Oh, absolutely. Pretty early on in the pandemic, when we were working in our emergency operations center, our focus was really communicating to our own employees, because we needed them to know what we were doing, what we needed them to do. And so that was where Jen and I were very focused early on. The challenge came, when you're with an organization that has more than 50,000 employees, if any of those individuals disagree with the communication or what you're doing to protect them, they have outlets, they have social media, they have the news media. And it quickly came, that our internal communications were being shared externally. We were being forced to defend ourselves and some of the decisions we've made without having a lot of preparation to make that defense. And so we did have a number of a lot of PPE related situations.
For instance, like the masks, or can you give us an example?
Yeah, for example, masks. Early on, prior to the recommendation of continuous masking, it was not advised that people continuously mask. And so there were some employees that said, well, I want to wear a mask anyways, and you're going to make me take it off. So masking was a big one. Reuse of PPE was another big one where, there were certain employees that believed that we might be putting them, in danger or at risk based on those practices. And so, they would share those versions of their stories externally, and we would have to respond to those. One of the things we did, shortly after several of those stories transpired was we decided to get out in front of that messaging. We partnered with the healthcare reporter at our local paper, the Arizona Republic. We started doing weekly meetings with her and our chief medical officer, who oversees our COVID response. And we committed to sharing information with her about some of the difficult decisions we're making. They're very unpopular. They're going to frustrate people or scare people, but they're scientifically backed. They're rooted in fact and as much evidence as we have at this time. And so we decided we would start sharing that information with her and get out in front of the story. And so the first time we did that was the week we announced our N95 reuse policy, which was N95 masks or respirators that our medical community wears. We went to a reuse policy. We provided information to her about the scientific backing of that practice and how other health systems have shifted to that practice. And so the story was very fair and balanced, and it just reaffirmed our decision that, getting out in front of that story was extremely important, and all stories, so that we could tell our story rather than relying on others to tell it for us.
Where then does an organization like Banner come in to help set the story straight?
Sure. So Pew did some research during COVID, and one of the pieces was around local media and how local consumers actually Americans believe that the information they're getting from local media is mostly factual about COVID. What that shows me is if half of Americans believe the information they're getting from their local media is highly accurate and a source of truth for them. That was one of my lessons learned is, during a second surge, I'm going to focus more on that local media because, to be completely honest, I was watching the same news that consumers, in our community were. I saw a lot of information that was not factual. And it concerns me that if half of Americans think that what they're seeing is right and it's not, it's our responsibility in the healthcare community to correct that.
Well, interesting thing is you are all in the business not to build your business. You don't want people in your bed suffering from COVID. And I mean, people are, screaming about fake news, but I know a lot of journalists too, and for the most part, they want to get it right, but they are only reporting on the information they're getting. So if they're not getting accurate information, do you ever feel like you wished you had your own TV station and you could be the healthcare go-to channel?
For me, I think one of the things that we've really done is empowered our team members. I mean, with information that they can share with their families and friends. They're the best ambassadors. Our team members are the best ambassadors. So now we'll just stay behind the microphone for me.
Well, and I think we do tell our own story. Media is one of the channels that we're able to communicate that through, and it is a trusted source for news. So that will never go away for us. But we do have a storytelling podcast, and we have our social media channels, which we've used for a lot of stories that we've told. One of our posts just yesterday was about an elderly couple that are both hospitalized with COVID, and the daughter reached out to our administrators and said, "Can you let them see each other? Can you put them near each other?" So the next day they were in rooms next to each other. The wife was able to go visit her husband in his room. The administrator had bought her flowers for him to give to her, and it brought tears to me. And I mean, I hear stories like this all the time. So, but just to show, the heart that we have and that we're doing everything we can to accommodate these patients at a time when their loved ones can't even be with them. But we were able to tell that story. I mean, there were several media outlets that wanted to tell it as well, but we were able to share that story, through our own communication channels as well. And it had great engagement.
My brother suffered from COVID back. He was up in Seattle area, and he was one of the first to get it up there. An outdoorsman, great shape, lives on 20 acres, not around people, and somehow he got it. He ended up in Swedish hospital for 6 days, 4 days in ICU. I did a show several months ago as he came out, and just to recall that experience. And of course, up there and then, like Banner, when it started coming through here, they were learning, and he said that. They said, my healthcare was great, but they were making it up, he felt like. And he wasn't blaming them. He's saying, I was a test patient. And he said the most sobering thing is when he woke up and he looked up above his bed and it had the "Do Not Resuscitate" sticker above his bed. And he's like, what's that about? And they said, we can't come in and save you if things go like really, really sideways. And in fact, on next week's show, he is coming back on to talk about his long hauler experience, because he's going through after several months of battling it, is still having challenges, blood clots and energy levels and everything else. So he couldn't say enough about the great professionals up at Swedish Hospital. And I'm sure you all have those same stories as well coming through. While you were trying to give the absolute best care you can and keep your people safe, what were some of the biggest pitfalls you had? What was something that blindsided you that you just didn't see coming that that you can avoid in this next round?
having the right channels in place to reach people. It is, like Becky said, we're a 52,000 person organization.
And you're spread out
Across six states.
6 states, and you are in charge of communicating with everybody.
Right. We're across multiple geographies. And then don't forget, we already have the age-old challenge of having a workforce that's desk-bound and non-wired. And then we thrust about, thousands of people to work from home. So how we were going to reach all of those people was daunting. And I think it was a lesson learned in real time, in the sense that the run-of-the-mill methods we had to reach team members, which was email, really, weren't going, and an intranet site, were not going to work.
And you started 2020 with that. Like, all right, we're dialed in, we're good to go.
We're dialed in, we're good to go. I mean, we knew that we needed to do more, but there wasn't that sense of urgency. We have multiple channels now and means of reaching team members. We have a text tool where you can opt in to get information about, this is all for team members. You can get information about childcare and resources available to help you, and mental health resources, because we know what this has done to, both Frontline, for those that are visible and invisible, quite frankly, have suffered greatly. We have a leader platform that we do bi-weekly, and soon to move through monthly, where our chief medical officer that Becky referenced gives us situational updates, and leaders from all over the system dial in, and we talk about what HR tools are available to help you as a leader and help your teams. Our CEO, who was making practically weekly videos in the beginning, he now does a monthly update, and he shares where we're going as he's like he gives the North Star of the organization on where we're going. We have these huddles and these bundles. We have a multitude of innovative tools that we didn't have before. And I think what I would say is that we have those now to dial up or down, depending where we are in that crisis, always with the EOC being the guiding point for us. So I think it's that we have in our arsenal a lot more tools and means of reaching team members. But I think the last thing I'll say on that is the foundational elements of communication haven't changed. It's about sharing what you know and not being afraid to share what you don't. And I think, look, here we're headed towards the potential of a vaccine. We don't know when or how or who will be eligible or what that will look like or, what will be mandated. But we share what we know now. And we share it very candidly and openly. And we say, when we know, you'll know. And we don't have to be perfect in our sharing of information.
It sounds like you launched a lot of tools quickly, where if you didn't have a pandemic going on, it might have taken months, if not years, to get approval to launch this. And did that work well for you? And did you end up ever launching too many things, trying to get too many things going? Because I could see myself doing that. Oh, let's do this and this and this. And then wait, let's focus.
Right. And hey, we're about to launch a podcast internally. Just keeping with that theme. I think it's a great question. Here's what I would say. I think we were not afraid to try. And if that text tool, for example, has just 3,000 people, but that might be a mom who needs childcare so she can make her shift. And it might be somebody who is on the brink of feeling like mentally, they're going to just collapse, they're going to snap. So, Park, what I would say is I don't think it's too many tools. We have lots of data on them, and some of them don't have data. For example, the digital signage in our hospitals, we don't have a monitor above looking to see how many people are walking by and reading them. What I will say is that there are certain tools that we will likely sunset or, collapse when the pandemic subsides, but always knowing we'll be able to dial them back up. And that's what's key. Yeah. Because you can have absolutely overload of tools.
Becky, how about you? You had all this experience in communications and healthcare and public relations. What was the one thing, if there was one thing that knocked your socks off, wow, I didn't anticipate that?
I mean, I feel like every day there was a one thing. Yeah. It was every single day. I was waking up to a different problem to solve and how we were going to communicate that problem. The entire situation, the past several months, it's been very unpredictable, even for us. And we're very well trained and we plan and prepare for situations like this. I can't imagine being a different business in a different industry and having to go through this, not having that infrastructure in place. I think we learned early on that the way we were communicating was very direct and fact-based. It's exactly how every one of my conversations goes because that's how my mind works. But what I realized is COVID has stirred up so many feelings for people. And I think we realized we needed to acknowledge those feelings. It's impacting all of us differently. For you, your brother had COVID and you weren't there and you couldn't visit him and be there with him. And for him, it's the prolonged effects of COVID that are impacting him. For some people, they now have to work at home and be their child's keeper while they're doing online school, and they're trying to do 2 jobs in one. And there's some people who have depression, and the isolation is driving that to a higher degree. So all of us have been impacted by COVID, and I think not dismissing any of those feelings and acknowledging them in our communications has been really important. And we've started to shift to a lot more kind of heart-forward messaging where, when we're telling people, hey, masking mandates in some cities are being lifted, but here's why you should still wear it. We also need to acknowledge, we understand it's hot, they're uncomfortable, you want to make personal eye contact and facial expressions with people, and that's how you connect, and acknowledging all the things that people don't like about masks and why they feel like they can let it, hang below their chin. We're just trying to connect with them and acknowledge their feelings and frustrations with masking, but also give them the facts of this is why you should continue to wear them.
One of the things I thought about in your world is, let's use a battle, an invasion analogy, because we have been invaded by coronavirus. So you all are the frontline workers and communicators. So you are the generals that are helping to combat this invasion. If our shores were being invaded by a hostile force, our generals would get together in the Pentagon and, take care of business. Well, you guys don't get to do that. You have to do this from home. So not only are you taking on these new things that are happening every day and you're learning by trial and fire, you're not even able to sit across from each other and figure out how to do this. You've got to be doing it from your kitchen table in some cases, and you're on the phone. And how has that impacted you all? And what have you learned from that? How has it maybe tweaked one of your communication skills or several of your communication skills to be efficient and compelling communicators no matter where you are, whether you're in front of them or if you're virtual, stuck in your basement on your Zoom session?
So I will say when COVID first hit, we did have the luxury of meeting in person. So our emergency operations center is quite a large group, but there's a core within that's the command center that they're your core commanders. The public information officer is one of those roles. So Jen and I were physically present in our emergency operations center for the first month or two of COVID. Even after the recommendations came out about distancing, we went to a larger room and everyone was sitting 6 to 10 feet apart. So we transitioned to virtual probably around May. I would say around May. We were so used to in this, again, I'm going to refer to the EOC, the Emergency Operations Center. We were always used to this cadence and agenda and kind of, we knew what to expect when it came to report outs or what was going to be discussed. It's very structured. And so I think it helps us with our virtual discussions because it's predictable. We know when we're on. We know what we need to share. So that has been very helpful. I will say my son, who's 3, coming to me asking me to wipe his bottom in the middle of a press conference has not been as easy. Whatever virtual meeting I happen to be in at the moment, I can relate to so many others out there who I'm sure are going through the same thing. But it has also helped me hone my multitasking skills to be able to be in the same environment as my children who don't understand personal space. And if mommy's home, mommy's home.
I couldn't agree more. I mean, Park, we're both working mothers. We both have young boys. What we have done in terms of trying to support people working from home and subsidizing childcare and flexing schedules where possible has been unbelievable. And, I had similar experiences, when my 8.5-year-old got sent home and was doing enhanced distance learning, he doesn't think about walking up when I was on the phone with my boss and taking out his recorder and playing it for him. And he, I think my boss has a new level of compassion for me after hearing the recorder performance. There is a level of grace that the truism about showing grace and receiving grace. I am just so impressed with my colleagues who have been under sustained pressure, Becky chief among them, and yet we've been able to do that for one another. And I think that you can talk about a company's values and a company's mission, but there's nothing like a crisis to test it and validate that they are the right ones and you have the right mission. I really see them as the DNA of our organization.
Now, you two are remarkably accomplished communicators. You've been doing this your whole lives, being out of college, and you've dedicated your careers to that. You're very good at it. And, I've been doing it a long time, too. Maybe a little bit longer than you two. Maybe combined, I'm not sure. A lot of times we are not taught how to tell stories, or, in our initial education and coming out, and you follow the book and the, inverted pyramid structure, and here's our crisis communications plan, and just get out there and put up a stern face. You all over at Banner over the last couple of years have been very proactive about taking story training and work. How has that impacted, or how have you used it to your benefit in COVID? Where you're not just communicating a line of information, but you're actually embedding it in a purpose-felt, humanized story that people can relate to.
A while back, we developed our brand voice and our core principles for our communication. And I think that has been extremely helpful because it's across multiple channels, multiple teams. Anytime Banner is communicating, our brand voice is the wise guides. We're the knowledgeable experts. We're the subject matter experts on health and science and research. And we want to help guide our Sophia. She's our persona that we've also developed.
So you have a singular persona that you
can persona,
which is so smart, because story is all about that singular narrative. Even though you have lots of stories to tell to lots of different people, it keeps you focused.
I mean, Sophia is a woman in her 40s. She's caring for her two children, one who has a chronic condition, asthma. She has two sets of parents that she's helping to care for. One of them, a couple of them that have chronic conditions. She's a teacher. Her husband works at the local utility plant. She's very relatable for the majority of our audience that we're trying to reach. She's also the woman in the household who's making the healthcare decisions. And so we want to be the wise guide for Sophia. We don't want to tell her what to do, but we want to educate her and give her all her options and let her choose the option that's best for her family. It might not be Banner, but we feel strongly that it's our responsibility to help educate her and connect her with the resources that are going to be best for her and her loved ones. And then we have our core principles when it comes to communicating that help guide us to make our communication consistent, regardless of whether or not it's our podcast or a blog or an internal communication or with the media. That's extremely helpful foundation for any story you're going to tell. And I would say the other aspect of storytelling that has been very helpful for us during COVID especially, but just in general as we tell our stories in healthcare, is always wanting to figure out what the end game is. What do you want people to do as a result of hearing that story? And for me, if I'm telling the story of man in his 40s who got COVID with no pre-existing conditions, who was hospitalized on a ventilator for 3 weeks, he's recovered and now sharing that story with others. What I want to get out of that is those, 20, 30 somethings that are going out to bars, partying, not wearing masks, congregating because they think that the virus can't get them. I want to show them that it doesn't discriminate and that there are people out there who, for one reason or another, we still are learning about this virus. We don't know everything about it. And clearly he was a healthy man in his 40s that got that virus and it almost took his life. And so for me, with that story, the end game was I need to reach that audience. And I think with every story we tell, we need to know what we want that action to be as a result.
Yeah, that's what I like to coach too, is that if you're putting your story together, think about your audience and ask yourself the 3 questions. What do you want them to think? What do you want them to feel? And what do you want them to do? What is that very next step?
And Park, I will just tell you, to complement what Becky said, internally that's been critical. I mean, when I think about this video series, which was a risk, quite frankly, we started out doing this weekly series featuring our CEO as a source of sort of keeping people informed before we had kicked off the town hall series that features a myriad of our senior leadership team. But they really were just him telling stories of people on our front lines. These stories of heroism on the front lines and the stories of heroism, like I talked about from our EVS and culinary teams, some teams that are less visible. But
EVS is
environmental services. Apologies. Okay. I have to throw one more acronym at you.
And I'll throw it right back at you.
I know you will, Park. But I think it was, having a very clear call to action action in those. And what is so interesting to me is first I thought, oh, is it going to be hard to gather content for these weekly and then now monthly? Well, we could have them talking for 20 minutes in a month. It's like now we have to almost build out an editorial calendar, make sure the content's fresh and compelling and timely. But they have become such a point of pride for team members to see that they're being featured in the CEO's monthly video. It's just one channel, but it's really, really neat to see that.
And those stories are about an individual.
They are about an individual, a team. If it's about a process, whether it's about our growth or it is about, like I said, supply chain, or it is about revenue cycle management or the environmental services, it's about teams. It's about teamwork. And yes, on occasion there is a particular individual, but largely they are stories of teams making a difference for patients and for one another.
And the reason why I ask that, Jennifer, is what I often coach is, even though you're telling a story about a team or an organization, find an individual that you can focus that story on who represents the team or the organization. You think of any movie that you see, even though they have a cast of characters, the story's usually and pretty much always about one person. And the same is true when you're telling stories in the corporate level and healthcare, no matter what industry you're in. And that's one of the things that I coach a lot, because people do get caught up in, well, let me just talk to you about the client. No, tell me about the person in the client whose impact you have. And to underscore that with COVID, again, I go back to my brother's podcast, the show. We spoke for an hour and 15 minutes, and his daughter had just graduated from medical school, and she's doing a residency in San Diego. And so she told her side of the story. She was our healthcare advocate for our family because she could talk the lingo with the doctors. She kept us up to speed. But Chris told a story that none of us ever heard. And he said it was on day 5. And he was feeling really lonely and really sad, and he was in his room, cordoned off, you know. He said all of a sudden, this little Italian lady came in. And he looked over and he thought it was a nurse at first. He goes, he realized it was the janitor. And she came in very broken English and said, oh, how are you? And she said, don't worry, I'll pray for you. And then left. And then the next day came back in. And she said, oh, you look better today. And here she was, frontline worker in the COVID patient's room, risking everything to clean it. And she turned around and looked at him and said, oh, I will pray for you again tonight, and you won't be here tomorrow. And she turned around, and he was released the next day, and he never saw her again. But I mean, and when he told, I brought a tear to my eye because I hadn't heard that part of the story. And when people respond, and I've had thousands upon thousands of people listen to Chris's COVID story, that's the thing they remember, that little incident. Do you have one of those stories from Banner? You must have a million of them. Can you share one?
It made me think of one of the nurses that we brought in. She's actually a traveler. She had just worked in the surge in New York City at Elmhurst, and she had just transitioned into ICU care recently. She was in more of a progressive unit prior to that. So she was newer to ICU care, to being around, very critically ill patients. She was thrown into the fire at Elmhurst. They were in the height of their surge. And one of the things she witnessed a nurse doing on her first night at her first rotation at Elmhurst was a COVID patient was passing. And so the nurse was with the patient while the patient passed. And then the nurse stepped outside of the room and was speaking with the family and just let the family know, your loved one was not alone. I was holding his hand. I was there with him until he passed. He did not have to do this by himself. And so she committed from that point forward that she was going to do that for every one of her patients. And she was going to personally call those family members and let them know that their loved one was not alone and that she was there for them. She did everything she could to make them comfortable, and she was just a presence. And so that story reminded me of her, because when you have visitor restrictions in place, and our COVID units are still highly restricted, the only time we're allowing visitation now, which has been eased, is for end-of-life visits. We're still not allowing day-to-day visitors. And so you're in isolation, you're sicker than you've ever been before, in an ICU, a lot of them on ventilators. And to just have that one person you can connect with, whether or not it's the person who's cleaning your room or your nurse or, someone, a human, just being able to connect to them, and to know for those family members who aren't able to come into the hospital, to know that there are nurses like Bridget who are holding hands as people pass because you're not able to do that with your own loved one is just, it brings chills every time I hear it or think about it, because it's a role that they don't teach you in nursing school or medical school. It's maybe something that they briefly graze over through your education, but that bedside manner and being that human for your patients is so important. And I mean, that's one example. I've seen and heard a lot of stories like that throughout the course of COVID. And it's just, with visitor restrictions in place, it's just that much more impactful.
Jennifer, how about you from an employee standpoint?
The people that go into battle every day, there's just no words for those physicians and those nurses and those clinicians, those every day going into battle. And we have countless stories of people who gave of themselves, lived literally outside their home because they didn't feel safe going home. Banner had instituted a healthcare, Housing for Healthcare Heroes program where we were able to subsidize some of that housing, but still people were not able to go back to their own home for fear of bringing the virus home or of their exposure. But what I'll say is this, I have such an appreciation for those that are also just less visible. Our customer experience center, they are the first point of call, literally, for scheduling, for, testing, you name it. And the algorithms, I talked about the information changing daily. So the algorithms for eligibility for testing or where you go, changing every day. And these people taking calls from folks that are desperate, our visitor a policy changing, and they've got to be the one to relay that. So I think for me, what I have an appreciation for is the village it takes to provide healthcare. Becky talked about our brand voice, and one of our principles is about being in the supporting role. And I think that is a value that carries through to the organization and shows up in the way the team members have cared for one another. We call our employees team members. And how they have cared for one another, there has been such humility and grace through functions, quite frankly, I didn't even know existed. I didn't know some of these functions existed within the organization. So it's been remarkable.
So final question for both of you, and I'll go back to my brother Chris, because when I talk to so many people and I say, well, I don't really know anybody that's had it, or they had it and it only kind of hit us and it's really not that big of a deal. And I go, yeah, okay, well, I haven't had it, and most of the people I know haven't had it, but I almost lost a brother to it. And their argument is, yeah, but he's like that 0.00014% of America that is going to get to that level. And I go, I don't know if you can put a number on it. When it's that close to you, it's real. It's like there's a boogeyman out there, and it could come and mess you up big time. So we are now experiencing a second surge. So two things. What have you now learned where you think you'll be even better communicators, storytellers during the second surge to help get the right information out so that we all can, live the truth in this and get through it? And what should people be doing?
When we first started with COVID and when we were first in this emergency operations center, we knew very little about it. We didn't know how it was transmitted. We didn't know. We're still learning about the long-term implications, what treatments worked for it. I think as the months have gone on, we've learned so much more about the virus, so much more about what treatments are effective, so much more about how to protect ourselves and others. And it's less scary, at least to me personally, and a lot of healthcare workers I talk with, because we know so much more about it now. We don't know everything, and I think that would be my wise guide tip for those of you who are out there who think prevalence rates are down than what they were at the surge. I can walk around without a mask. It's fine. I don't think that's the case. And just recently within the last month, they came out with the research around myocarditis and athletes and how, these young, healthy athletes with no pre-existing conditions are now, having to deal with a pre-existing condition that resulted from a COVID diagnosis. So there are findings that scientists are coming up with every day that help influence how we treat COVID, how we prevent COVID. But I think the biggest piece of advice for everyone out there is wear a mask, distance, do all the things that, we know have proven to reduce the spread of COVID, because it's not just your brother who's impacted by healthcare resources being strained. So if our capacity gets to a level where we've reached max capacity, there's difficult decisions we have to make. We have a plan in place for that, an addendum that outlines, what we have to do in that situation. But that might mean that someone like my dad, who was just diagnosed with cancer, might not get certain resources because he's less likely to survive than I am. it's a scary thing to think if we stress our health systems too much, we could get to the point where you or me or my kids might not get the health care that they need and deserve because the resources aren't there for them. We didn't hit that in our first surge, thankfully. I will say we're starting this second surge at a much higher prevalence rate than we did the first. And so where we started before was much lower than where we're at now, which could indicate that the surge could be worse or higher than what we saw back in June and July.
Yeah. That's a really interesting point because I think most of us don't think about the extenuating circumstances, the ripple effect of COVID. So we think, well, I get it. It's just a bad flu. I'll get through it. We think of it as life or death. I won't die from this, so it's no big deal. But you don't think about the impact on the hospital and the availability of resources and taking care of other people.
And elective surgeries.
Yeah.
I mean, if we have to stop elective surgeries, that means that my dad's bone marrow transplant might be postponed because he can survive off of chemo, but he could be put in remission with a transplant. So when you get to a certain level, that's your trade-off. And I don't want to put you or your family or anyone in the community in that situation because I know personally how it feels, with a loved one who could be impacted by something like that.
Absolutely. Oh, thank you. Jennifer?
Yeah, I mean, like Becky said, there have been so many learnings. I think what I would genuinely say about communication is, like you said, Park. I mean, it's we're disciples of your master storytelling class, and we put so many of those principles, including I got to give a plug for the ABT, to work. I think it is really about showing compassion. It is about being authentic. It is about acknowledging those emotions. You cannot communicate anything that factual or science based until you do that first with the workforce, and I think we've learned that, and we do that, and we do that beautifully. We've infused a lot of humanity. There are a lot of unknowns, and I know people are tired, and it's noisy, and there's social unrest, and there's an election. It feels very political, but it's a very real disease that is robbing people of lives and families of loved ones. And I think, like Becky said, they were not asking a lot. Mask, distance, wash your hands, stay home if you're ill. These are really basic things that I think our kids can do. So I think we need to model the way. And that really isn't hard to do. And so we would just ask that on behalf of anyone who's got a loved one, quite frankly.
Have you lost colleagues to COVID?
We have.
How many?
We can't disclose the number for privacy, but yeah, there have been colleagues who have passed, and the families that have consented to allow us to share their stories, we do share those through a moment of silence during our town halls internally. So we're able to acknowledge them by name and share more information about where they worked and who they were prior to that loss of life. So I knew one of them. I had worked with him in the past, but even the ones that we didn't know personally, I think it's just working in the healthcare industry. Every loss is an impact for all of us. So
absolutely, and it's just one more extraordinarily important reason why all of us need to we all have a Russian roulette gun in our hand, and we don't know when that bullet's going to go off or if it's going to go off. And we have to stop it. We have to put it down.
And honestly, like Jen said, our kids can do it. I have a 3-year-old. He wears a mask all day at daycare. The only time he takes it off is to eat and drink and take his nap.
3-year-olds are the toughest sons of guns going.
And the other day the other day he called me out for not washing my hands for 20 seconds because he stands at the sink and counts to 20 every single time he washes. So the fact that my 3-year-old can do it sometimes better than I can, there's no excuse for anyone in this country and the world to not be able to take those simple steps to prevent the spread.
Thank you both.
Thanks for having us.
Thank you so much.
You are under extreme pressure and have very little time. I really, really appreciate you coming in and sharing how Banner Health is working through COVID to keep us all safe through your communications.
Thanks so much.
Thank you all for listening to this edition of The Business of Story. Please, 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 don't be complacent about COVID. Wear your mask. In fact, they're masking up right now across from me. Wash your hands, sanitize. I feel like, the old man or your mother telling you this. Social distance. Don't go to crowded bars and crowded restaurants and crowded places. We have a long way to go, and it may get darker before it gets brighter in all of this. We want 2021 to be the most promising year yet to get through all this, and we can only do it with all of your help. If you don't believe me, join me next week when I will have Chris back and his daughter Elsie, and he's going to talk about what it's like being a long hauler. And if you get it, what you're in for, providing you survive it in the first place. So please join us then. And it'll actually be more uplifting than I just made that sound, but it's worth listening. It's my public service message to you and Chris's way of saying, believe it, it's out there. Until then, remember that the most potent story you'll ever tell is the story you tell yourself. So make it a great one. Thank you so much for listening.